This video will discuss details about eyelid surgery, also known as blepharoplasty.
Blepharoplasty is the enhancement of the eye by removing excess skin and fat pads. Patients who are good candidates for the procedure are women and men with redundant skin and eyelid wrinkles, eyelid bags, and tired look to the eyes despite a good night of sleep. My preferred way of doing eyelid surgery is under sedation, also known as twilight, or general anesthesia. It usually takes 1 hour for the upper eyelids and 2 hours for the lower eyelids. The usual recovery time is between 1 to 2 weeks. Earlier if you are not concerned of showing bruising and swelling in public. Some important considerations in preparation for your surgery are your eyebrows droopy? If not significant, the eyelid surgery may improve overall dynamics of your eye. Are your eyes dry? If so, eye drops might be needed for a prolonged time. And finally, are your cheeks saggy? This may be better addressed by a facelift, improving the dynamics of the lower eyelid. Some frequent questions that many patients have are, how can I improve my bruising? Arnica and bromelain are over-the-counter medications that may help improve the overall recovery. Is fat grafting an option? Yes. Many doctors are using this technique to try to improve the lower and upper eyelids. However, if you gain weight, there is a possibility that your face may be deformed, since the fat will behave the same way that it behaves from the source that it comes from. In my opinion, I would not recommend it. How bad is the pain? Not bad at all. Usually pain pills take care of the pain. Now let's explore the results of some patients that have undergone this procedure. This patient underwent upper and lower eyelid surgery. She was in her late 30s. Her main concern was the tired look of her eyes. You can see on top her eyelids before surgery and below after her surgery. This patient underwent upper and lower eyelid surgery. She was in her mid-60s. Her main concern was the tired look of her eyes. You can see on top her eyelids before surgery and below after surgery. This patient underwent upper eyelid surgery. She was in her mid-40s. Her main concern was the tired look of her eyes. You can see on top her eyelids before surgery and below after surgery. This patient underwent upper and lower eyelid surgery. She was in her mid-50s. Her main concern was the tired look of her eyes. You can see on top her eyelids before surgery and below after surgery.
Thank you for considering us for your procedure and welcome to our practice. Please contact us by phone, email, or through our website.